Hi, I'm Chris with Afflictor, and today we're going to talk about the most important consideration for broadheads and blood trails. Stay tuned. Okay, so one of the biggest calls that we get is, I would like to switch to your broadhead because I want to have a bigger blood trail. And sometimes that is a scary call because it is not always the broadhead that is the result of the blood trail. Now, of course, some broadheads are certainly inherently better at producing a blood trail. When we think about a hybrid or a mechanical with a wide cut, of course that wider cut is going to give us more surface area, a better chance maybe of getting a vein or an artery that was just a little bit off, that if you had a smaller broadhead that you might miss. But also, if you look at having a smaller broadhead, if it's put where it's supposed to be, you don't really need to worry about the blood trail. But there is a lot of things, a lot of variables that go into a blood trail, and I want to talk about that and why it's scary when I get that call. Because inevitably, it is all going to boil down to shot placement. Now, yes, you can give yourself a broadhead that has a little bit more cut, a little more chance, and that could equal some more blood. But if you shoot them in the backstrap, you're not going to get any blood. If you shoot them in the brisket, you're not going to get any blood. But also, if you shoot them in the vitals and that shot is high, there may be no way for that blood to get up to those holes for you to get a good blood trail, no matter what broadhead that you are looking at. So let's talk about that for a minute. So regardless of choice of broadhead, if you hit your animal high or at a crazy angle or don't get a pass through, there's a lot of factors there that will cause blood to pool within the animal. Your arrow could help block the hole if you didn't get a pass through. But most of all, if you have all of that pooling of blood in the cavity, it has a long way to go to get up and really get outside of those holes. Oftentimes, the blood we're looking at isn't even from the holes. It's coming from the nose and mouth. So you get a good lung shot, that's where you start to see that spray and that weird blood trail that isn't all the time a nice steady flow. And so in those cases, you may be depending on that type of nasal and mouth blood to do any tracking at all because your holes have just not had time for the blood to come up to leak out, or they've been blocked. On quartering shots, you can actually run into situations to where you come in at such a steep angle that the skin itself, after a pass-through, will block the hole. And the deer may be dead in 30 yards, but you're going to be disappointed because you didn't get a blood trail. And we get calls like that from around the globe with whatever broadhead all the time. I shot a deer, I recovered it in X amount of yards, however, I didn't get any blood, I want more blood. Well, if the deer died, and it died within 50 yards, your broadhead did its job, okay? It was just a matter of how that arrow went through, where that arrow was placed, that determined the blood trail. So as you look at different broadheads, some of them have, of course, built-in characteristics that are going to up your chance. We've already talked about the hybrid or the mechanical giving you a little bit wider cut. But also tip design, secondary blade, all of these play a factor in opening up that wound channel and keeping it open. On our K2 fixed, our really wide secondary blade with this 90-degree angle leaves a huge hole. It has a lot of trouble closing. In fact, in most cases, it cannot close. And so you have a broadhead that's inherently leaving a coring effect. And there's other broadheads on the market that also leave a coring effect. But that is, even though this isn't a super, wide cut, this is definitely not 2 inches or 2 inches plus. If you put this broadhead in the right spot, it's going to make a hole and you're going to get a good blood trail as long as it is in an area where you've hit something that's going to bleed and allow it to get to the hole quickly. You'll see a lot of times on slow motion of shots when they're placed in the right area, when you got that breadbasket zone of the heart and then also coupled by that real bronchial area of the lungs where it's highly vascular, and you see the blood trailing out on the exit wound, and on that first step you can just actually watch it pour through and pour out. That is because of perfect shot placement. If you get it in the right spot, you are going to have a good blood trail. Now, some teeny tiny broadheads or broadheads by design that are very narrow with narrow tips may not leave a giant gap or a giant wound channel. So you could have less blood even on that, but the lethality was the same. The broadhead is doing its job. So you can't always depend on blood trails, even though as hunters, that's what we want. We want this great blood trail. For us, the largest cut we have is 1.75 inches. We like that cut because we feel that it is optimal for damage, but it also gives you the best penetration. In our testing, when we got out to that 2-inch and up, now all of a sudden we're seeing really decreased penetration, which now you have to have more momentum, more kinetic energy to make all that come together. Where this 1.75 inches is passing through, making a beautiful wide cut and doing its job and leaving a great blood trail. So you want to kind of get some consideration, because if your setup is not set up for a 2-inch, 3-inch, and now even 4-inch mechanical broadhead, 4 inches, I just want to say no, because your setup has got to be optimal to make a wide cut broadhead like that pass through and do what it's supposed to do. And you're also risking blade breakage and other things if you hit bone. So you really have to determine for your own purposes what is best for your setup and how it's going to work. But you need to keep in mind that blood trail isn't always the result of your broadhead, but more the result of perfect shot placement. Most of the time when we talk about having perfect shot placement and blood trail, sometimes the best blood trails are not from a perfect shot placement. If you shoot a deer in the rear end and you hit that artery that runs through the back hams, you will have tons and tons of blood. If you hit your deer high and you shoot that aortic artery and there is tons and tons of blood, it's going to be in the cavity. It's not going to go anywhere, and you're talking about a high pressure artery with lots of blood going through it. But as you get to the lower anatomy of the whitetail and you are shooting a perfect double lung, right where it needs to be, or a heart shot, those are the holes that are going to produce the most blood the fastest and give you the best blood trail as you start to track.